Hello, my name is Jennifer Arredondo, and today I will be talking to you in regards to motivational interviewing and the importance of it. I believe that with motivational interviewing, a patient must be health literacy, and with health literacy, it allows the patient to have health empowerment. The reason I chose this topic is because it definitely hits home to me more than anything. I just recently had to deal with the passing of my dad and my grandfather. Now, my grandfather was 93 when he officially had passed away, so he was an older gentleman. So you can understand that motivational interviewing probably didn't help him in a sense because he was an older gentleman. He's kind of set in his ways. And he was already at the point where he had pancreatic cancer. So he didn't want to make any type of health behavior changes. So, in a sense, motivational interviewing didn't help. He believed that, he lived his life and to the fullest, and he was pretty much ready to go. On the other hand, with my father, he was diagnosed in the late 1980s with HIV. He'd been, consistent with his medication and has always, every month when he took his blood work, it was obviously he was taking the medication to show that he didn't have, his blood levels were fine to show that he didn't have the HIV. But he was also battling with COPD, and he also had his left lower lobe surgically removed years ago. So in the recent I would say in the last year, his health had deteriorated at its worst that it had ever been. And motivational interviewing, while it may have helped when he was at the early stages of his illness, his chronic condition, it wasn't helping him. And I felt like motivational interviewing, it consists of 15 minutes, that the provider provides to the patient in regards to it's an intervention that helps a patient change health behavior, changes in their health, basically to improve it. My father was, in a sense, not he didn't want that anymore, and I felt like health literacy kind of hindered him because he really relied on me to provide him the understanding of what the physicians and the nurses were telling him. He didn't have a concept, or he didn't have the capability or the capacity to understand what they were trying to explain to him in regards to his health. And in a sense, that didn't give him the patient empowerment to feel confident and to be able to make health decision makings in regards to his health and try to improve it. And I felt like, in a sense, some of these providers, you know, they didn't do their job, basically. So it saddens me that they lacked trying to, because I feel like the responsibility is equal part of the patient and the provider. And yes, my father was he was health literacy. He wasn't health literacy, sorry. I feel like, okay, he wasn't, but it should have been the provider or the nurse who took the time to sit there to make him understand. My father relied on me. And there were a lot of times where, of course, I'm a full-time student, I have a family, I couldn't always be there. And so that left for, room for errors, for misunderstanding. And essentially it just came down to the part where he just he'd given up, and eventually, he decided that he just didn't want to partake in anything anymore. He was done. He'd had enough. But I do feel like motivational interviewing, it can be a good thing for patients if the provider simply take on the responsibility of ensuring that a patient is health literacy. Because when a patient is health literacy, it does give them the empowerment, the knowledge, the confidence to help them determine what they want to do to make changes in their health behavior. And if you don't give that to the patient, they're not going to participate in the motivational interviewing. There's 5 phases that they go through, and each process of those phases are meant, they're designed to, to push the patient into, further enhancing, their change, their wanting of changing into, making a good decision, of health behavior change, basically. So I do believe that motivational interviewing works, but I think that it takes equal responsibility, not only for the patient, but also for the provider. I think that if the provider, takes on an active role as well, it can work. So I just, and also, I want to tell you, Professor Archiopoli, thank you for understanding during this tough moment. And I appreciate you, giving me time to get everything together as far as my paper and whatnot in my discussions. So thank you. And I really, really enjoyed your class. Thank you. Have a nice day.